Hey, it's Dr. Hannah with this week's Hot Topic Thursday. Today I want to talk to you about TMJ issues. A lot of people don't realize that chiropractors can actually adjust your jaw. Most people just think if you have a jaw problem, you'd have to go to the dentist or the orthodontist or someone else other than a chiropractor. But truth is, we actually know how to adjust it because it's a joint. It's connected to C1, which is that top bone. So it's kind of like our bread and butter. It's just a specialty for some people. Not all chiropractors feel comfortable adjusting jaws. Some people have had additional training on it. Some people haven't. So if you have a chiropractor that you're not quite sure, just make sure you ask them first. Most of the time they will tell you, yes, I'm comfortable adjusting a jaw. Sometimes they won't, and that's okay. But there are chiropractors out there who will adjust jaws. So we know how to adjust jaws here. So if you're a patient here, no worries, we can adjust your jaw. Just make sure you tell us if you're having jaw issues. But one of the big things that people don't realize that's not normal is your jaw should not pop when you are talking, when you're eating, when you're opening your jaw. Now, it seems kind of common sense to us that, oh, hey, my jaw shouldn't make a noise whenever I open it. Not everyone realizes that that's not normal. So if your jaw is popping, clicking, crunching, grinding, those are all issues to say that there's an issue with your TMJ, which is this joint that's right here, or your jaw, that's another word for it. So those are issues that if you're having those, then yes, there's something that we can definitely look at. If you grind your teeth at night, that's something else that when you're grinding your teeth are just kind of shifting everywhere. It's making your muscles super tight. There's a disc that's right here, so that disc can kind of come and move a little bit, can cause pressure, can get stuck. So then one side of your jaw will open before the other side, and that's why you might get clunking things or grinding. That's also a sign that your jaw needs to be adjusted. Jaw pain is another reason that you can say, oh, something's not quite right with it. If your jaw gets stuck in a position, whether it's open or closed or anything like that, those are also other indicators that, hey, something needs to be done with your jaw. Now, when you get adjusted, there's a lot of ways that you can get adjusted. Most likely you want to do something soft, a little bit gentle. You don't want really anybody hammering on your jaw. That would be really bad. It's really scary. You don't want to do any damage. But if you go to your dentist, if you're having some TMJ issues, what a dentist will do will probably give you splints. Splints are a wonderful idea as long as you go to a dentist who specializes in TMJ issues. My recommendation, if you're going to do that, get your jaw adjusted before you get your TMJ splint, because that way to make sure that your jaw is as much aligned as it can be whenever you get those splints. I have splints. I wear one at night. I wear one during the day. They have been amazing for me. My jaw was so bad that I would get every time I would eat, I couldn't hear out of one ear, and it was just awful. I just couldn't stand it anymore. So that's something that I would highly recommend. If you're having jaw problems, get adjusted. Go see a dentist who is a TMJ specialist. They can make splints for you. This is something that you don't have to live with. But again, it's something we don't know unless you tell us. So if you're having these jaw issues, make sure you tell us. We can help you out. We can send you in the right direction if it needs something more besides just an adjustment like a splint or something like that. So that is all I have for you today. Let us know if you have any questions. Again, if you're having some jaw issues, just remind us on your next appointment, and we'll see you guys next week.